Okay, so next speaker then, it's Dr. Philip Crowley from the Health Services Executive. So Philip is the National Director for Strategy and Research in the HSE. He leads on strategic planning, research, population health and well-being, global health, health rights and performance. And I've a long CV, but I'm just going to dip into the things that I thought were particularly fascinating. And one is he is a doctor who works part-time as a general practitioner. So I'm always rather impressed by people who do sort of very, very demanding jobs, but still practice, and I know a number of medics managed to do that. He worked for 5 years in Nicaragua, trained in public health in Newcastle upon Tyne, and worked for 6 years as the Deputy CMO in the Department of Health. So it's a great pleasure to welcome you, Philip, and I think your topic is the converging crisis, health and climate. So over to you.
Thank you very much, Alan. And look, it's lovely to be here today, and I really appreciate the EPA and the SRI partner allowing us to be a partner with you today. And I think it's really, there are very deep relationships there that I think we need to really plumb over the next number of years, and we'll be coming back to you about that. And it's lovely to share the platform with the Irish Doctors for the Environment as well, a group I'm very kind of linked with. I was interested in your comments about the inequalities, and like I co-led the public health response to the pandemic, and I hate to bring up the pandemic because I know we all would like to think we're beyond it at this stage, but it is still lurking around. One of the things that struck me, I mean, my practice is in the inner city, and so one of the things that struck me, I have a nice garden as well. I mean, it's not a huge garden, but I have a nice garden. I was able to go out into the garden when I was locked down and do my physical jerks or whatever I was doing. But so many people who were my patients live in small inner city flats, had no access to any green space whatsoever. And I would say observed the lockdown in a really pristine fashion. So I think in a way, whatever successes we had in the pandemic, a lot of it was down to that kind of solidarity and kind of societal commitment and the understanding of, I suppose, the communication that was going out to them. But it was very, very impressive to me, I have to say. And that's, I think, why we avoided some of the worst impacts. COP27 in Egypt is obviously ongoing. And I don't know, I'm sure we're all equally impressed with the UN Secretary General Antonio Guterres, who's called it pretty clearly. He talked about, obviously quoting AC/DC, we are on a highway to climate hell with our foot on the accelerator. He talked about the planet is fast approaching tipping points that will make climate chaos irreversible, and that this decade will be decisive. I sincerely hope the world leaders are listening to him. At the outset, I suppose, just talking about healthcare and climate, the best form of healthcare for the climate is no healthcare at all. That may sound a little bit odd, but basically what I'm saying is we need to really up our game in relation to prevention. We need to keep people well and keep people away from needing healthcare at all in the first place. That's the most beneficial thing we could do, it seems to me. But overall, I mean, essentially, you know, our climate, as Laura's very ably laid out, is in crisis in many ways. These are some of the facts around what we've already done to our climate in terms of ice-free and desert-free land surface that's devoted to cropland or pasture. Half of all accessible water is used for humans. 2.3 million kilometres of primary forest has been cut down since 2000. That's a terrifying statistic. 90% of monitored fisheries are harvested at or beyond maximum sustainable yield limits, so that's not going to sustain. And concentration of greenhouse gases are at the highest levels for the past 800,000 years, and that's a long time. So what about climate change in the health sector? Well, clearly climate change endangers human health, and Laura's already alluded to some of these impacts. Extreme heat, heat-related illness and death, poor air quality, respiratory cardiovascular disease impacts very clear there. Severe weather, droughts, flooding, changes in temperature and rainfall altering waterborne illnesses, and we can see that at times as well. Environmental degradation, extreme weather affecting mental health. And I suppose that's a thing that I often come back to in this space of climate is we have to strike some kind of sweet point between urgency and pessimism. I think if we really hammer home to people that we're going to hell in a handcart or whatever the phrase might be, we do need that urgency, but we do need some optimism as well. And I do think that climate has a severe impact on mental well-being, just anxiety, concern about the environment, and certainly impacts on me in that way, I have to say. So in terms of what the health sector also is a key contributor, and I'll come back to this in more detail, but we are a significant contributor in healthcare to environmental impact and change adversely. High energy intensive buildings, wasteful procedures, lots of single-use goods, lots of transportation. Our supply chain as well is a massive contributor. Pharmaceutical supplies, devices and foods. We use a lot of energy in our buildings and in our system. And I think we take choices a lot of the time, rightly so, with patient safety and quality at the heart of those decisions, but not enough of the time with the impact of the climate on the climate of those decisions. So I think that's a space we are definitely getting into. So we have a significant impact. We contribute, we reckon, in Ireland to 5% of Ireland's global greenhouse gas emissions. So again, just to kind of reiterate the point, heat, strokes and deaths, respiratory disease, cardiovascular, gastrointestinal disease from water runoff and things that Laura's already referred to, vector-transmitted diseases. Mental health, I really couldn't overemphasize that as being an impact for the impact we're having on the environment. So these are things we're already seeing in Ireland. Floods, we've seen foodborne disease, we've seen waterborne disease, and as Laura's pointed out, the impact on respiratory disease is already playing out. So these are just some figures from the UK. You can see really, for example, in healthcare, I'll come back to our climate strategy, but one of the arms of our climate strategy is clinical impacts on the climate. And anesthetic gases is a very significant one. You can see desflurane being the primary culprit. And I won't get into the details of anesthetic gases because it'll be outside my own comfort zone. But it all suffice to say that these gases are used in anesthetics and they all go out into the environment thereafter and contribute to global warming and greenhouse gas emissions. So inhalers, the inhalers that we use for asthma, the meter dose inhalers are significant contributors as well. And you can see from the third pie diagram that it's the supply chain, it's what we procure is probably the most significant contributor, and that's where we need to look at using our leverage on our supply chain to make it green. The College of Anaesthetists in Ireland have been, thankfully, great partners in our initial work on creating a climate strategy, along with the Irish Doctors for the Environment, some of whom are co-members. And they've been doing quite a significant amount of work on anesthetic gases, and we're going to build on that. But they're looking to reduce the use of inhalational anesthetic agents, particularly those with a high environmental impact, and they're going to promote environmentally friendly techniques of IV anesthesia. So I do like a driver diagram. I've done a lot of training in QI, quality improvement, and we love driver diagrams, so I thought I'd include one. Obviously, we need to improve health and reduce carbon at the same time. So we need to reduce activity, and a lot of that is about prevention. And health and well-being is under my remit, so I'll be very energetic in that space over the next number of years. Self-care and lean pathways of care then when we are delivering care. And then improve the carbon efficiency, low carbon alternatives, and looking at operational resource use. And we are in that space firmly at this point in time in the HSE. So we've come up with the HSE Climate Action and Sustainability Strategy. It was something that I suppose I felt and others felt, and Roisin Breen, who's in the audience, was absolutely pivotal in getting this piece of work done. I think it's fair to say that if you look at the HSE, it has a responsibility to deliver healthcare, it has a responsibility to promote health and well-being, but in a way it has a bigger responsibility in our society given its reach, its impact, its number of interactions with the public, its reach within the public is second to no other organisation. It is a very large organisation and it has a very large workforce. So I believe with that comes some additional responsibilities, and this is trying to enact one key one, which is that we need to become, to a degree, leaders in environmental care in our society. So we're committing to achieve net zero emissions and later than 2050, and we need to make sure, as Laura said, that that's not just an idle kind of commitment that we don't deliver on. So we will be measuring against that and delivering healthcare which is environmentally and socially sustainable. So we've built the work. We've tried. There was probably a bit of a tendency initially to look at work on the environment as kind of, let's focus in our buildings. Let's look at the emissions coming out of our buildings. We've already got a good bit of work going there, and let's try and focus on what we can really achieve there. Great idea, but as Laura's pointed out, so many more aspects to the environment that we impact on. We could not, and we managed to ensure that the strategy is way broader than that, and it's looking at the green environment in our own environments that we manage. So looking at greening up the spaces that we own. The transport and mobility. During the pandemic, you'll be aware, we moved an awful lot of care online. Not all care can be done online, not all care can be done remotely, but a lot of it can be. And we are going to be working very strenuously to ensure that trends are sustained and built on. And looking at mobility generally and the transport for our staff as well. Sustainable procurement, I've already alluded to. It's a complex area. On one level, you would say the HSE has got massive leverage. It's a very big buyer of pharmaceuticals, of all kinds of materials, food, etc. We should have massive leverage, but actually you'd be surprised in a way, particularly global products like pharmaceuticals. I would say our leverage, we need to use it carefully, because we are a small market, and at times suppliers simply move us out of the market if we become too problematic. But at the same time, we have leverage, and we will use it to ensure we have a green procurement approach, and that our suppliers adopt green models of delivery. So green models of healthcare, I already alluded to that as well. We've had a group which the Irish Doctors of the Environment was very pivotal to, looking at that, and we're going to be building on that now that we have our strategy pretty much complete. Water and waste management, again, we need to look at that. And then we do have to look at the fact that certain milestones have already been passed. We need to look at adapting to the environment as it evolves and being resilient to it as a health service. So we have done some things so far. It's not that we build this strategy on sand or on nothing. I think there's fairly firm foundations for it. We've achieved a 26% improvement in energy efficiency in our buildings in a 10-year period. Probably not enough, but it may be a good start. And again, I try to be optimistic and build on what's positive. We've identified 170 significant energy users, which account for 75% of our energy use and carbon emissions. So that's where we'll be focusing our efforts. We have 111 local energy teams in place, and that's what in a way gives me the most optimism about our plan. That we have a kind of an infrastructure that gives us some hope that we might actually have the impacts that the plan lays out that we need to have. So these energy teams are in place, and we're looking at the idea of changing from the concept of an energy team to a green team, so broadening their remit into all the areas that I've already outlined. And we're implementing shallow energy retrofit engineering works at the moment. So we've achieved a reduction of 13.5% of the 51% target by 2030. So we need to really accelerate that work at this point in time. So in terms of the green environment, again, I think what this slide demonstrates to me is the power of our own workforce. I think people who go into healthcare care about certain things. They're not going to healthcare because they want to become the next Elon Musk or whatever else, to use a random example. They go into healthcare because they care about people's healthcare and they want to make things better. I think the same kind of people care about the environment. They want to make the environment better. I believe, in fact, I'm certain it's a massive preoccupation of our staff, and I'll come back to how important that is. But I think this demonstrates that people are just getting on with things locally to try and make the environment better where they are. The Cork University Hospital has a wildflower zone, including beehives, and using recycled plastic outdoor seating for staff. St John's in Limerick, static spin bikes, outdoor picnic tables and cultivated garden. These may all seem a little bit trivial, but they're only examples. And I suppose what they're examples of is local initiative. And if we can if we can free local frontline staff to act on their best ideas for the environment, we'll be making a lot of progress. The College of Surgeons has built an outdoor gym, bicycle racks, eco-friendly garden furniture for staff, and pollinator-friendly wildflower gardens. And our eHealth national programme reduces the carbon footprint of outpatient and community-based care, as I've already said. So in terms of adaptation, we are certainly working on our communications around climate and its impact on health, and how we need to adapt to our current climate. We're working on skin cancer prevention and a climate adaptation plan for the health sector. We're also doing a vulnerability assessment of our health infrastructure to severe weather events, which have become increasingly common. So greener models of care. I've already shown you some of the work the College of Anaesthetists have done in NUIG, Galway. They've been repairing leaks. You can imagine a leaking anaesthetic pipeline, just leaking the noxious gas straight into the environment. 80% reduction in CO2e and from N2O. So people locally acting and finding solutions. At a national level, 20% of anaesthetic departments have ceased using desflurane completely. That's the most noxious of the anaesthetic gases. So that, in a way, using Laura's kind of 50-50 she was on, I'm afraid we're only on 20-80 there, but that means it can be done. So the 20% can show the 80% how to do it, and that's what we intend to do. The HSE Green Healthcare Programme resulted in many examples of improved practice. For example, in Tullamore, 0.5 kilograms less clinical waste per day per bed, which is pretty significant when you add it up, which also saves money. So for the accountants in the audience, or in my audience, we can say that. Again, an interesting project on inhaler use. Again, an audit on inhaler use and what we can do. The Irish College of General Practitioners is going to be a key partner for us here, and Andre Rochefort is in the audience, and we'll be working with the college as well to explore safe use of good asthma care that protects the environment. So, kind of coming to a close. Sorry to bring up COVID-19 again, but as a public health co-lead for the pandemic, it was an extraordinary couple of years, and I can see people in the audience who shared that experience in the health service with me. And it was, on one level, it was very sad, it was very challenging, it was very frenetic and complex. It was very anxiety-producing, because I remember early on, we were on a video call with Wuhan, and we were kind of asking them, what's the incubation period for this virus? How long is this infective before it's symptomatic? We hoped it wasn't, of course it was. All the worst aspects of this virus came to pass. I mean, that level of anxiety was considerable for everybody and for our society. But I take so many positives out of how everybody pulled together around a common purpose. Extraordinary volunteerism to the health service from the public. Within the health service, people just saying, I'll change, I'll do this, I'll do that, whatever it takes. Mass mobilization of our staff to new roles to combat the pandemic. Amazing use of improvement skills to really improve care overnight, change care overnight. We put in new models of care literally overnight. But obviously, this has had an impact on our staff as well, no more than on our society. And it's a significant focus on our National Service Plan this year, which we're finalising today, which is slightly unfortunate timing, but that's the way it is. And there will be focus there on staff retention, looking after our staff, and trying to help them recover from the experience of managing the pandemic. But we really developed a can-do kind of, I think the HSE is kind of characterised as being bureaucratic, well, let's not pretend, bureaucratic, slow to make decisions, must say no, kind of no can do. Well, what was interesting, I suppose, during the pandemic was, like, I've been on the leadership team for 12 years, and I was there the day we made a particular decision around taking over the ICUs in the private hospitals, because we were in touch with London. Their ICUs were overwhelmed. We were in touch with Northern Italy. They were long past being overwhelmed. And we became extremely concerned that we would go down the same route. So we made that decision, and we worked out how to enact it. It took about 15 minutes to make the decision. I suggested to the leadership team at that time, could we just pause for 1 minute before we go on to the next decision to reflect on the decision we just made. And I said, having been on the leadership team 12 years, we'd normally talk about making that decision for about 6 months to a year. We'd pilot it for another 6 months or maybe a year. We'd then evaluate it for 6 months and show that it worked, and then we'd abandon it. So I think it's fair to say that when we were empowered and trusted and we had the resources to make decisions, we made them. They weren't all correct, but we showed, I suppose, that we can, as a group of people, when we're united around a common purpose, we can act. And if we're trusted by government, we will continue to do so. We became comfortable with mistakes, hierarchies were flattened, and we deferred to expertise at whatever level of the organisation it arose from. And that's not something that has always characterised the organisation. So, what does that mean then, in a way, for climate? I think it means a great deal. I think what it shows is that as an organization, we can come together around a massive burning platform, common objective, absolute national priority. And climate change is just that. So we want to play a significant role in tackling the climate crisis, and we will be staying in touch with our partners after today to ensure that what we do is informed by their knowledge and expertise. But we have this major workforce, great workforce, fantastic people who care. And it's going to be absolutely central to the development of this strategy. So we'll be doing a lot of work in the communication space, in partnering, in ensuring that frontline staff can do stuff that they see fit, that they think is the best thing to do, not that we decide is the best thing to do. It won't be command and control. It will be freeing people up who have lots of expertise to act. We will be giving central guidance on what works, obviously. We will be giving strategic advice on priorities that we see globally and in other healthcare systems. But we will try to mobilize this workforce to a common goal. And we believe that if we do so, we will achieve much more sustainable healthcare. And we will also be doubling down our efforts on prevention, because no healthcare is the most sustainable healthcare of all. Thank you very much.